Hello, everybody. Welcome to another live interview for the Data First AI Later newsletter. This is an initiative founded by Professor Rajendra Gupta from Health Parliament, India, in association with our alliance of the IHD, the European Institute for Innovation through Health Data, and of course, the Health Data Forum, charity based in the UK. I'm Paul Nunes Dia. This is my English pen name for author pen name, the Health Data Forum Firestarter, a facilitator, and I'm happy to have here with me today a very special guest, as all our guests are special. But on this occasion, I'm very proud to have here with me Catherine Chronaki. She's very well known in the world of health data. Thank you for joining, Catherine.
It's a pleasure to be with you, Paul, today.
Let me
And
let me also introduce you to our speakers because our viewers, because some of them may not know a little bit about yourself, if I may. Catherine Chronaki is an engineer by profession, but she has a long-standing career at IHL7 Europe as a Secretary General. This is an organization based in Brussels. And besides this, of course, also a member of the board of directors of CDISC, and also recently, since December 2023, the scientific coordinator of the XShare project. And that's going to be the main dish on our interview today, the XShare project. But Catherine, let's first kick off about talking a little bit about you. What is it that makes you tick every morning when you wake up? What's your passion currently? Can you share that to our viewers?
thank you very much for this question. This interview is about XR, sharing and controlling our data to gain actionable insights. So, this is very much on the theme of this session, data first, AI later. And it speaks to the Health DS, the European Health Data Space Regulation, which was launched almost a month now, and has the aspiration that people have control of their health data, that people have control of their data in general and health specifically. So, the question I'd like to speak to you about is, all right, so you have your health data, right? What can you do with them?
Absolutely.
This, this is exactly what we are trying to illustrate in XR. In XR,
Absolutely.
we are, yeah, go ahead, please.
Yeah, I got that you have this project, but I'm also curious to understand a little bit more about you first, Catherine. Why are you the person that you'll be the ideal person to be the scientific coordinator of XShare? What is it, the driving motivation beyond your work right now?
Oh, that's a very important question. Um, so you are asking why I feel that XR is important, right?
For you and for your life.
Let's start with a personal story. Um, some years ago, I had a medical condition, and everyone told me that I had to essentially undergo an operation. And at that time, I was thinking, well, maybe, maybe not. Maybe we can work with a medicine that can help us control the situation so that I don't have an operation. It was a complicated story. It lasted approximately 3 years, where I had to change completely the way I ate. I became vegetarian. I had to monitor with lab results, the condition of an experimental drug. So I had, it was dangerous essentially to liver this particular drug, like many of the newer drugs are. I mean, they may affect some of your systems, right? So I had to go through several lab exams every other week, according to the leaflet of the medication, which also had a patient card. So it really had risk minimization measures there involved. In fact, halfway through through this treatment, I had there was alert from EMA, the European Medicines Agency, that we had to stop this medicine. So this was a kind of an interesting situation. And I felt that I could have control of my life by actually managing all the data. So this is one particular story that kind of motivates me. But also what motivates me is the fact that we can connect. We can connect the data that come and are stored in the health system with the data that we ourselves manage through sensors and wellness devices. And we can have a much more detailed view of our physiology, of the way we work. And in fact, this is not only precision medicine per se, it's also precision health. And this for me is the ultimate challenge for an engineer, to actually understand better how their body works and how we can enhance, cure, and manage our health and wellness.
It's interesting that you share this personal story, Catherine. Thank you so much for that. Because in fact, sometimes we get so abstract when thinking about health data and their paramount importance, but then we forget how this impact in real people, real life of the people, right? And it's so critical, right, for improving health outcomes overall. It's interesting to see how an engineer now is contributing to the success of the medical professionals, right, in the field. It is more and more important that projects like health
XAir,
right.
XAir,
Yeah,
extreme sharing, XAir.
excellent. Tell me about the origin of this project, because it has an origin,
Yes,
right?
yes. So with that background and a personal story where I really had to control my data and actually also champion my health with health professionals and the team that would support me in this journey, the HealthDS regulation arrived. And the HealthDS regulation is about controlling your data. Yeah. So it's a very strong regulation for patients. It really puts patients at the center. Patients can access their data now in computable form in HL7 FHIR format. They can download their data in HL7 FHIR format. They can ask that their data can be rectified. They can even share their data with whomever they feel that they should share their data. And most importantly, they can even rectify their data. So we are talking about gold here. Data is gold, it's the new currency. So this is extremely important. And at that time, we were also at the end of the COVID era, right? So at the end of the COVID era, we had a lot of experience with patients sharing information about them. They were sharing information about infections around them. And public health is becoming an online activity rather than an offline or delayed activity. Even with COVID, we had very frequent updates, right, on how the health of the community was going. And we also had the monitoring of the environment, like the streams, to see if the community was healthy or not, or if we should expect an exacerbation. So public health is different now. But not only public health, also clinical research. In clinical research, we talked about digital protocols. We talk about connecting health care, wellness, and clinical trials. So the world is becoming connected. At this stage, the important point is the role of each one of us. The role of you, the role of me, the role of my relatives or my children. How are we going to responsibly control our data and use them for the improvement of our health, the enhancement of our wellness, but also for the community, for our neighborhoods, for our society at large, to have better data, to run more resilient health systems, but also to improve treatment for diseases that are now having us struggle, but also in the future will be the core of our attack towards disease.
Mm-hmm.
So this is my motivation in a kind of a long monologue. I'm sorry for that.
No worries, Catherine. I'm learning already a lot from your perspective. But so I have a couple of questions for you, Catherine. One of them is obviously you're stressing the point of data as gold, and I'm wondering, is the regular citizen in the streets, let's say, for instance, my mother-in-law, are they conscious about the importance of the health data for their personal lives? And let me tell you a story. The other day, a company arrived here where I'm living in a major shopping mall, and they put a display to capture retina scan from the visitors to that shopping mall. And I suppose that they were paying €1 or something. They were giving some gift to anyone who offered to volunteer to scan their retina. And out of a sudden, they were creating a huge database of retina images. And I'm wondering, if you're paying €1 per retina scan, what is the value of you having ownership of a huge database of retina images? Isn't this something that involves a little bit of data literacy in the part of the public?
Yes, Paul, you are actually right on spot with the word data literacy. Data literacy is about promoting the quality of the data that is gathered around us. And also, it's about responsibly using this data for a good cause. And yes, I think the most important, perhaps, point is using data to make good decisions. And this is where I think we run short. And this is where there has to be a lot of education. And in fact, we are doing in XR one of these things. We have thought of the notion of the adoption kit. And in fact, on the 28th of May, we have our first webinar. This webinar, it's called eHealth DS, European Health Data Space, Adoption Kit for Citizens, which is an interesting thing if you think about it. eHealth DS is a regulation that puts citizens in control of all their health data. At the same time, are we ready? Are the citizens ready for this revolution that's coming up in 3 years? Are we ready to address the transformation of the health system and the responsibilities that are coming up with your control of your data, being able to press the yellow button, as we say, and get experience of having your data to use for yourself, for your family, for the community at large. Online, not offline in secondary use, in primary use, Because my thought is that clinical research should be an aspect of primary use, not secondary use. But
That,
maybe you can pull up the slide with the first adoption kit for citizens,
yeah,
so that people may be willing um, to enroll and join us and share their story, because we are looking for stories. We are looking for stories of data empowerment. We are looking for stories of strength through data.
let me see if I can find here the overlay. This is the citizen one, the last one here. This one.
Yes,
Yeah.
this is the one. Yeah, it's on the 28th of May. It's for an hour, and we will meet Marina, person that was empowered with her data. And she was empowered to the degree that she could change her life and also change the life of her family. So please join us and come and share your own story of what the yellow button would mean for you.
Absolutely. This is amazing. But I understand that XShare project also involves a collaboration, a collective. Tell me a little bit more about who is involved in the project so we also amplify the information to our dear viewers who are watching us right now.
Yes, yes. So indeed, XR is a large consortium of companies, of associations, of research centers, of governments, of regions that share this idea that we can make the yellow button a reality. We can give people their data in a format that they can use to improve our society, to be first in AI. Because to be first in AI, you need to have good quality data. So we have several research organizations. IHD is one of them. We have 6 standards organizations: CDSC, IEEE, IHC, HR7, and SEN, and SNOMED. And we are all working together to create the specifications that would allow us to get our data in a format that we can productively use with AI algorithms we can trust and have humans in the loop. So, in that context, we are also creating these days ASIA. This is the holding entity for the hub. The hub will bring together their standards organizations and research organizations and governments and industry. It is supported by industry with Digital Europe and MedTech Europe. And we do hope that we will bring forward um, specifications that are easy to use and make a difference for our society in the context always of the European health data space.
Absolutely. As you know, we are hosting the Health Data Global Hybrid Summit this year in Wales. UK is not part of the European Union. What is the proposal for extending this work to countries that are not EU members? Is
Mm,
this still valid for other non-union
absolutely. Yeah.
countries?
So remember, you introduced me as an engineer, and I am an engineer. And there used to be a very powerful punchline uh, in the early days of my career, which was called "May the source be with you," and the reference was. Was to the source code, and this was before the open source movement started and so on. So maybe the source code be with you. And now in this data era that we are going, where data literacy is important, well, maybe this could be transformed into may the data be with you. But not only the data, maybe also we need to add them, maybe the data and the format be with you, because you need to know the shape, the coding of the data, so that they are clean, high quality data that you can use and you can trust to make decisions, because that's the ultimate goal, to understand what this data wants to tell you, what you need to do now, how do you act with wisdom of the data at your side.
So inspiring, Catherine. I'm enjoying so much this conversation. But tell me so a little bit more about what is the expected results. How long this project will last?
Yeah.
I know that you have also here other information that you would like me to display. I have at least two
Yes.
other
Yeah.
informations. Tell me a little bit about what will be the expected outcomes in the end. What are you
So
going
this
to
is
do?
yeah, this is a project that we are doing things a little bit different. First of all, we are now midway in this project. June 25 is the midway of this 3 year project. And we are doing three important things. The first important thing is that we are launching the organization that will sustain our work. That's the hub under the Asia logo. And this would be a membership organization that will make sure that we embrace change management, that we educate, that we deliver specifications that are robust. Yeah. So that's the hub, the so called European health space data hub. It's the European Electronic Health Record Exchange format Standards and Policy Hub. That's the full name of the hub. And as I said, it brings together influential SDOs to work together. One very important element that I'd like to share with the audience and you, Paul, and maybe I can persuade you to be one member of our community of excellence, is the community of excellence. When when they say that if you want to go far, you are going not alone, but with company, with good company. That's the essence of what we are implementing. We are building a community of excellence that will work together to make XR a reality. And not only for one day, because many projects end and then they're gone. We would like to have a sustainable influence in the capabilities of companies and in the capabilities of citizens to get control of their data for actionable insights.
Mhm,
So
mhm.
maybe you can show us then the second picture, which shows the community of excellence. And maybe you would also click on the QR code and become a member of our community because we need you to make uh, the health DS a reality.
Okay, thank you so much, Catherine. But this is this open to citizens outside European Union or is exclusive
Yes,
for
it
them?
is. It is because you said something very important that people are not confined to one geographic area. Our health affects the health of our neighbors um, and developments in drugs, in healthcare are also to be shared so that we can have better outcomes for us, for our families, for our friends, for our communities.
Okay, so that's the proposition, community of excellence. If you feel that you are already leading the field in a certain way, please capture the QR code and join the community here, as Catherine is kindly
Yes,
inviting us.
and also it's a learning community. So if you wish to learn from others and bring some of the your some of these ideas to your community, please join us. We need a village. This is not something that can be done by a small group of people. We need to reach the tipping point for citizen control over their health data in a standard format.
Fantastic, fantastic. Oh, I like this participatory and root grassroots based movements because those are the one theoretically the ones who could sustain themselves.
Exactly. Yes.
That's
Yeah.
knowledge.
And
That's
and, and for us, after 30 years in doing all sorts of different projects in healthcare, I think that it's time to have something really sustainable. And now I will get to my third point, and I know that I spent too much of your time, so you need to go to lunch. The third point, we talked about citizens, we talked about individuals. And now, what's the third thing? Remember, I'm an engineer, all right?
absolutely. What will be the third thing, Catherine? Good
Third
question.
thing is products,
Okay.
innovative digital health products and services.
Okay. Okay.
So remember we said, what can we do with this data? Okay, so there is a regulation that for the first time in Europe gives control of their data to citizens. What are we going to do with this data? Of course, we need to educate citizens to make responsible use of this strong capability. But then there is a call for hospitals to put the yellow button on their websites, to put it on their apps. And there is also the strong responsibility to make it easy and low cost. We don't want new companies to go bankrupt before they start innovating. This regulation demands that every electronic health record system, and it's a broad definition of electronic health record system, is able to support interoperability and give the data of the individuals in the format. So here we are launching, we actually launched 1st of May, the open call for early adopters of the XR button. This is for patient-facing apps. And this is about the capability to do three things. Be able to download the data in the format, and these are the six types of data that are in the regulation as a first step: patient summaries, laboratory, prescriptions, dispensations, hospital discharge reports, and imaging reports. And be able to import this data because you want to use the data in the end, and also be able to read them through a QR code. That's a technology that the WHO introduced. Many of us know it with the COVID certificate, where you can use a QR code to actually read the data. And you can use also the QR code to give your data to another app or software. So this is what actually we will be testing for the first time in June in the IHE Connectathon. And at that time, products that are able to demonstrate this capability will get the XAR industry label. So this is our plan for the next couple of months. And you just showed us the screen with the QR code, which is the expression of interest for innovators to join us, to join our accelerator, join our work to make the format a reality and prepare every one of us for a low-cost implementation of the European health data space.
I love that because you're actually bringing to the practical realm, seeing as a narrative and the regulations that are high in the Olympus, in the minds of the citizen, right? The European health data space for the citizen, regular citizen, should be something out there that someone in the European Commission is thinking on behalf of us citizens. But what you're doing is actually the opposite. It's trying to make it root-based, grassroots-based, and have the citizen with their hands in the process, having the startup companies in their hands in the process, and making it really a global movement. It's
Yeah.
impressive, Catherine. It's really impressive.
I hope that with your help and the help of everyone that is listening to us today, we can do the dent. We can make some of these ideas closer to our everyday life. So if
So
you are a patient, if you are somebody that works with data, share your story. Join our adoption kit webinar and share with us the story. If you are
absolutely.
an expert, share your expertise if you believe in our cause, if you are a believer. Be a member of the community of excellence. And if you are a company, come work with us to make it cheaper, more easy, more effective to implement this regulation. It will be mandated anyway.
Absolutely. I'm totally convinced, Catherine. Thank you so much for your time here and for sharing with us this incredible project. Dear viewers, dear participants, please share the word, right? We have all, each of one of us, a contribution now to make. to this cause. It's more than believing now, it's actually doing, it's taking action. So again, I'm going to show the slides here for where you should be targeting. If you are an entrepreneur, a product creator, this is where you should be using the Xshare yellow button.
We we actually have a little bit of funding also for innovators here to take this step. Yeah.
Okay, so be warned that there's a little bit of funding available, so that should be also attractive to you in this case. Community of excellence. So if you are an hospital, an organization, you're already leading the way, so join the community of excellence. And last but not least, and this is so important also, we have the citizens at the center. And if the citizen kit will be available and launched on the 28th May in the Xshare webinar on the adoption kit for citizens. Wow, this is so comprehensive, Catherine. Congratulations.
Thank you. With you on board, I think we will make a difference. I very much appreciate your time and energy. Thanks.
Thank you so much, Catherine. And dear viewers, hope to see you soon. Stay in touch, follow our social media networks for upcoming interviews in these channels. Thank you so much. See you soon.
Bye bye.